One of the most rare yet feared phenomenons in sedative medicine is anesthesia awareness. According to the American Association of Nurse Anesthetists fact sheet, anesthesia awareness is a rare condition that occurs when surgical patients can recall their surroundings or an event, sometimes even pressure or pain related to their surgery while they're under general anesthesia. This occurs when the sleep and pain medication fails while the paralytic agent is administered, which virtually makes it impossible for the patient to communicate this dire situation to the anesthesia providers. In the United States, it occurs in 1 out of every 1,000 anesthesia cases, with severe pain being even more rare. Today, I would like to talk to you more in depth about anesthesia awareness, legal liability of the provider, lasting psychological effects, and possible prevention if any exist. So the first question is, what is anesthesia? It is medications provided to you that cause the body to feel an insensitivity to pain, especially in a surgical type of situation that's artificially induced. So the different types are paralytics, sedatives, and analgesics. Paralytics make you paralyzed, sedatives keep you paralyzed, and analgesics are for pain. When combined, these drugs work with the nerves to block any sensations needed to function and also treat any pain associated with the procedure. Just because they can't remember it doesn't mean it wasn't painful, is one of the rules that they go to follow. The causes and factors of anesthesia awareness is emergency cardiac or traumatic surgery is one of them, an emergency C-section, an equipment misuse, a failure of equipment, a known history of anesthesia awareness, past alcohol and drug abuse, and just an unknown fact of the matter that it even exists with you. One of the factors that we use as far as this goes is, as far as the failure rate, is who gives the initial medications. If it's an emergent condition, they just can't physically gather the full medical history of the patient. An urgent need for medications is not one of the, basically an anesthesiologist is not available to go over a full past medical history, and these come in classes 1 through 5, 5 being the most severe and 1 being almost none at all, and the most severe equals hearing and feeling everything that goes on. One of the cases that is more prominent in this is Kiljohn versus Grimes in the Supreme Court. Basically, the patient was going in to have gallbladder surgery and could hear and feel everything during the procedure, and it went through many appeals courts and finally made it to the Supreme Court, where the plaintiff was suing the defendant because the anesthesia did not work. The defendant was clearly the anesthesiologist who won the case. Basically, it was saying when you sign your consents before your procedures, it says that you basically waive your knowledge, saying that anything could complicate your anesthesia and or procedure, and the defendant actually won this due to the complications of the procedure being spelled out to the patient. Although the above was a true and tried and true case, many wonder what the psychological effects to the medication is and to having this procedure. The long-term effects is clearly PTSD, which is post-traumatic stress disorder from the event, which 60% of patients actually experience this after the event. Children not so much, due to their ability to forget a lot of pain and grieving. And all of this is basically due to the helplessness of feeling and seeing and hearing what's going on during the procedure. As far as ethical aspects go, Being a healthcare provider myself, I know that there are a lot of things said that maybe people shouldn't hear when you're treating somebody in a stressful situation that helps us cope. When these patients hear this, I'm sure that they remember it and they take it with them. As far as legalities go, as far as equipment failure, that is something that could actually come back on the provider, knowing that they didn't check their equipment before the procedure. Actually, people have reported that hearing music or hearing providers talk takes them right back to the event if they were to hear the same things again and cause those PTSD symptoms. As far as prevention goes, the best prevention is knowing, obviously, that you have this sensitivity to the anesthesia, as well as informing your provider at the time. When that can't go as well as planned, obviously in emergent situations there is no way of knowing other than a well-charted medical history. As far as on the provider side, they're going to measure your vital signs, make sure their equipment is up to date and functioning properly for the procedure. So today you've heard the topic that many did not even consider in existence, and unless you've personally experienced it, you wouldn't know. After informing you what exactly anesthesia is and how it works, I hope to have provided you with a better understanding of the risks involved when it doesn't work. Unfortunately, there's no way of knowing 100% that this is going to happen to you. However, supplied with the knowledge that I gave you today, you can hopefully ask the questions needed to ensure the top levels of safety or of care are achieved when anesthesia is appropriate for you.